Hi everyone, thanks for tuning in today. This is the second of 2 videos we have created in a series to share information about health and wellness and resources to support health and wellness with members of the Homewood community. In this video, we focus on addiction and substance abuse. Our aim is to educate community members on how to look for signs someone is struggling and how to help them. Early intervention is key in these scenarios, and we believe that through sharing our knowledge and resources, we can help people who need help get help.
Hi everyone, my name is Sarah. I'm a second-year occupational therapy student at the University of Pittsburgh.
Hi, my name's Emily. I'm also a second-year occupational therapy student at the University of Pittsburgh.
Hi everyone, my name is Leah DeLion and I'm a second-year occupational therapy student at the University of Pittsburgh.
Addiction is a chronic condition that involves craving something intensely, a loss of control over its use, and continuing involvement with it despite negative consequences. It is considered a biopsychosocial condition, meaning it is a combination of your genetics and your brain and how those two components interact with psychological and social factors, which is highlighted in the diagram to the right. Addiction interferes with the brain's reward, motivation, and memory functions. It is both a preventable and treatable condition. According to some statistics from 2011, over 20 million Americans over the age of 12 have an addiction, yet only 10% of those individuals receive treatment. It is clear to see that many people living in the U.S. suffer from addiction, and it is important to define addiction and know the risk factors associated with it. So here are the risk factors. No one factor can predict if a person will become addicted to using substances. There is a combination of factors that can influence and put an individual at risk. To start, biology can play a role in addiction. The genes that people are born with can cause a person to be at risk for addictive behaviors. Gender, ethnicity, and the presence of other mental disorders may also influence risk of addiction. In relation to environmental factors, the people who you surround yourself with can have a huge impact on addictive tendencies. Friends and family could peer pressure you. You may suffer from physical or sexual abuse. You may have been exposed early to substances. You may suffer from stressful life circumstances. These are all examples of how your surrounding environment can cause an individual to experience addiction. Addiction affects individuals at all stages of life. However, the earlier the substance use begins, the more likely it will progress to a diagnosed addiction. Risk factors and some examples are categorized in the chart on the slide. An individual can be addicted to anything that increases dopamine, or the feel-good chemical, in the brain. A few examples include, but aren't limited to, drugs, alcohol, gambling, shopping, sex, etc. The stages of change are a key strategy to consider when thinking about addiction. If you are trying to convince someone who is struggling with addiction to change their behaviors, knowing what stage of change they are in their journey can help you understand how or why the individual takes the actions that they do. The first stage is pre-contemplation, and in this stage, the individual does not think that they have a problem and they do not intend to change. Next is contemplation, where the individual is aware of the problem, but not ready to take the measures necessary to change it. Preparation is the next stage, and in this stage, the problem is accepted and the individual is ready to begin to take action, which brings us to the next stage, where the individual actively works toward modifying their behaviors. After action is taken, then the individual works to maintain the change in their everyday life. Finally, the last stage of change in relation to addiction is relapse, which is always a possibility on this journey. This is when the individual falls back into old habits of addiction. I think it is important to point out that there are arrows on either side of the chain above, and this is because the stages of change are always a continuous cycle. It is common to not progress in a line as it is shown above, but individuals can develop through these stages in any possible pattern. So when you come to an individual with concerns of addiction, it is important to keep in mind these stages. The individual you are trying to address may not be ready to make a change in their life, but instead may need your unconditional support to help them through their process.
Recognizing the signs of drug abuse is important for getting help and avoiding addiction and other negative consequences. Somebody abusing drugs might have shifts in their personality where they lack interest in their usual hobbies or activities, are neglectful of relationships or miss important obligations, partake in riskier activities, or have changes in their sleep patterns. You may notice that they are consistently ill. They might have unexplained injuries, changes in their weight. You might notice negative changes of their skin, hair, teeth, and nails. They may have physical withdrawal symptoms like sweating, vomiting, or trembling. They may also experience memory loss or have difficulty speaking. In terms of their mood and behavior, somebody abusing drugs may have a lot of mood changes. They may be aggressive or irritable, have bouts of depression, or even suicidal thoughts. They could be easily confused or very defensive of their actions. Early recognition is important so that the person abusing drugs can get help sooner. Without intervention, substance abuse can turn into addiction, which is more difficult to treat. Now that we've covered the reasons people become addicted and know the signs to watch for, what can you do when you identify someone you care about struggling with substance abuse or addiction? Knowing the signs is the first step. You might try having a conversation with the person, creating an open dialogue where you can express your care and love for them and show them empathy. Express your concern for their health and let them know they aren't alone. Ask them what you can do to help them and meet them where they are in their journey to change their behaviors. In some events, the person you're trying to help may not be in a place to receive that help yet. That's okay, and it should be respected. However, if you're worried this person may hurt themselves or someone else, seek help for them. Hopefully, after a conversation like this and some time to think, the person will be more ready to seek help and you can help them explore treatment options that are right for them. If you witness someone experiencing a medical emergency from any form of substance abuse, it may be cardiac arrest or a heart attack. It is crucial to act fast. If they are unresponsive, call 911 immediately or ask a specific bystander to call 911 immediately while you assess the person's condition. If they are not breathing, CPR needs to be administered right away. 911 dispatchers can walk a caller through the steps of CPR and provide additional instruction based on the situation and circumstances, and they can instruct you on how to use an AED if one is available as well. AEDs are equipped with audio instructions to walk anyone through the process of using it. Keep administering CPR until an ambulance arrives. There is also an app available to any smartphone user called Pulse Point Respond. App users who are trained in CPR can be alerted if someone nearby is experiencing a cardiac emergency. The app will alert these users of the location of the emergency, as well as call for an advanced medical care team. It can even help rescuers find the closest AED. Knowing the proper steps to take in this kind of emergency can help save a person's life.
Negative stigmas hurt those affected by addiction. Ways that negative stigmas about addiction continue to hurt those affected by addiction are immeasurable, but there are some common themes that are reported the most often by those with their own addiction struggles. Violation of human rights, especially in areas of healthcare and treatment, housing searches, general public, and jobs. Another is employment difficulties, both in retention and attainment. This can be difficult in small communities where rumors can influence hiring. Poor sense of self or self-efficacy, lack of confidence in self and outlook on life. Another is avoiding seeking services like mental health, treatment, drug counseling, etc. Lastly, we have continuing substance abuse as a method of coping with the negative attitudes of others, the self, and society. It is less likely for those struggling with addiction to reach out or seek services due to fear of mistreatment, abandonment, and loss of existing supports. This can lead people to struggle with or hide addiction for years and do irreversible damage. Reducing the stigma of addiction. Understanding that people do not choose to succumb to addiction and that it is not solely their fault is important to the recovery process. Harmful stigmas about addiction lead to negative attitudes towards those on their recovery journey. This can lead to a decrease in provided opportunities, discrimination, and perpetuated struggles for those seeking help or currently in recovery. It is easy to be an ally. Treating someone who is struggling with addiction with dignity and respect will help them to trust you and know that you are an ally. Promote positivity when dealing with stigma. Positive attitudes and support towards someone with addiction struggles helps you and them. Have patience, kindness, and hope. Even if you are not assisting someone through their journey, treating a person with kindness or support may allow them to have renewed hope and motivation, which are driving factors for seeking treatment. Be supportive. It may take someone years to be able to seek help. Being ready and available to support them when they feel they are most ready is invaluable. Someone knowing they can trust and be confident in your willingness to help will seek more opportunities for treatment and recovery. Supporting those who are recovered or recovering. Support systems for those affected by addiction, both during and after recovery, is crucial to maintaining health, safety, progress, and well-being. If you are still using, do not pressure someone to join you, even if it is something as small as a beer or recreational drugs like marijuana. Do not guilt someone for leaving a situation, friendship, area, job, family, or romantic situation they felt unsafe or unable to maintain sobriety in. If someone declines to participate in an activity such as casual drinking, do not ask the reason or pressure them. Instead, respect their decision and offer alternatives if possible. Meet someone where they are. Sometimes something like going for a walk, having a conversation, even grocery shopping with a friend can help someone stay on track and prevent them from using or going into relapse. Strong relationships and networks are absolutely crucial.